So thanks for that warm welcome there, Tom. Um, this is going to be an hour of quietness, just me talking to myself. A little bit about myself. I graduated with a diploma in manual osteopathy this year. So what that is, it's a manual therapy that looks at the body as a whole to treat a broad range of symptoms. Um, Very similar in nature to a chiropractor, but again, a little more of a holistic approach to the body. So prior to this, I worked at Good Life as a personal trainer for 7 years, and I've worked with a wide range of individuals from youth athletes to grandmothers approaching 80. So I've seen it all. Worked with a lot of different bodies. I've seen a lot of people who get hurt and helped a lot of people along the way. And I've had a lot of people with different goals. So over the last 8 years or so, I've taken about over 20 courses dealing with prehab, rehab, nutrition, exercise mechanics, therapy assessments, all that stuff, all that fun stuff. Um, so I've definitely got a broad range of knowledge that I hope that you guys will get something out of this. Currently, I'm the only registered level 3 neurokinetic therapist in the province. So if anybody comes to see me, this could be very advantageous for them because it's an assessment modality that addresses dysfunctional motor control patterns. So essentially just your motor control center in your brain. If I want to go walk somewhere, I get the motor control center has to say move the legs. So what can happen at times is we decide, okay, I want to take a shortcut, and then we cheat our pattern. So through NKT or neurokinetic therapy, what we do is we try to get the body back on board to its proper motor control patterns. Okay, so for example, might test a limb, find out it's weak, and then find out another limb is affecting that. Okay, and it's great for athletes because I can actually give them homework, and over the course of the year, they can work on things that they need to work on. And yeah, I have about 25 years of experience between coaching and training as an athlete in wrestling. Kind of fizzled off for the last few years. Right now, just where personal training has been a focus and osteopathy. So um, although I have a lot of success as an athlete and as a coach, I wish that I could go back into a time machine and reevaluate my training regime. There's a lot of things I've learned. I've had some head injuries, reconstructive knee surgeries, and there's some things that have definitely slowed down me as an athlete myself. And I think in order to be successful and healthy in the sport of wrestling, you really need to address a variety of elements that go beyond the time spent on the mat, such as your sleep, nutrition, prehab, rehab, proper strength and conditioning program, as well as addressing the various psychological elements both off and on the mat. Okay. So some of the common facial and head injuries, we're going to start off with those. Concussions, scrapes, bruises, tongue cuts. If you chew down on your tongue, I know I've done that more than on a few occasions. And cauliflower ear, badge of honor. Out of all these, concussions are the most serious, and then they can lead to a variety of problems even decades afterwards. Even after the concussion is healed. So I know myself, I'm still dealing with it right now. Uh, we'll get into that later, but concussion symptoms, they can include headaches, ringing in the ear, nausea, vomiting, fatigue or drowsiness, blurry vision, con- confusion or feeling as if you're in a fog, amnesia surrounding the traumatic event, and dizziness or seeing stars. So, one thing I've noticed with myself is my eyes don't track properly. So, I've gotten tests done on them, and one eye will track well in one direction, one eye doesn't. And again, this is something I've been seeing a therapist for. I can attest to that firsthand. I've actually seen a cranial sacral therapists for the past couple of years to deal with the symptoms of these concussions. And I've had a variety of medications to deal with it, um, and was originally diagnosed with narcolepsy, chronic fatigue, insomnia, anxiety, and then I also had some musculoskeletal issues. So again, that was the first thing that was dealt with me when I first had my own personal neurokinetic therapy session. I was able to resolve some of my concussion problems, and now I'm dealing with it with a cranial sacral therapist. So definitely something that you don't want to overlook, because down the road it can cause a lot of different problems. And it actually was it had caused my back to flare up too as well. So it wasn't just related to the head. Um, so here's some examples of so for musculoskeletal injuries, two prominent ones are knee and shoulder injuries. And they're probably the most responsible for the most time off the mat, surgeries, and treatment. Okay, so like I said, I had two ACL surgeries, and both of them I was out for about 6 months and really didn't get 100% till like about a year after. So they take a long time to recover. So the common knee injuries would be ACL, or the anterior cruciate ligament. It's a ligament in the front. The MCL, which is the more in the middle. Meniscus, which is the cartilage, and knee bursitis, which is just like the kind of padding underneath the knee. Um, the latter, the bursitis, can be minimized with knee sleeves, or especially something with a cushion on it. It may even minimize the risk of for all potential knee injuries. It's not a 100% safeguard, but it can definitely help. A protective sleeve can keep the joint compressed and warm, which are two key elements for injury prevention. Again, it's not going to stop all knee traumas, but again, it's a nice preventative. So I'd highly recommend keeping those on, especially if you're complaining about any type of knee bursitis, or which is like an inflammation in the knee. So we'll get onto the shoulder. The shoulder is the most mobile joint in the body, and its mobility can make it increasingly vulnerable. Common injuries to the shoulder are subluxation, which is like a partial dislocation. A full dislocation is also common, and some further damage to the connective tissue, tendons and ligaments. We can see rotator cuff issues, but I find it's not as common directly related to wrestling, but it can happen. Following a plan, though, that balances strength training as well as stretching, designed for that athlete-specific needs, can be very helpful in preventing these shoulder injuries. So I'm a big advocate of weight training as long as it's done correctly, because I know a poorly designed program can lead you in the other direction. So, and also to doing exercises that are designed for your body. You'll probably find out over the years that there's just some exercises that just might not feel right. Like, could be an overhead press, could be a bench press, and just it's going to be one of those things, trial and error, and figuring out what works for your body and what doesn't. So what can we as athletes and coaches do to prevent these injuries occurring on the mat? So this is going to be very general in nature because I don't have everybody here on the table in front of me to actually examine them and see, well, oh, you got like an ACL issue, you have a rotator cuff problem here. Um, this isn't firing. But one thing I could say that I've seen over the years that is the biggest leak is improper, uh, I should say improper, lack of strength, functional stability in the core. Um, so building a resilient core can be really effective for getting improving the rest of the body. So biomechanics professor Stuart McGill, he's one of the leading back specialists in the world, written tons of books on it, and he quoted proximal stability, meaning stability within the center, is going to lead to distal mobility, meaning like distant, like um, mobility in your limbs. Okay, so if you don't have a strong, resilient core, chances are it's going to rob you in other places. It's going to either rob you in your knees, in your shoulders, maybe down in the ankle. I'm not saying that this is the only cure, but it can definitely make a huge improvement. Um, so it's difficult to give a one size fits all approach to core training. But however, if I were to recommend a specific core training routine for athletes new to core training, I would recommend the McGill Big Three. With those three exercises, the McGill curl up, the side bridge or the side plank, the bird dog, and then that's it. And this can be very important as for strengthening the anterior, the lateral, and the posterior muscles of the inner core. These, I find these exercises to be much healthier and more effective than traditional sit-ups, crunches, and various ab exercises at building an athletic core. So one interesting fact, there was more soldiers during the Afghan war um, that were hospitalized and had to go back home because of doing sit-ups than all the casualties of war in Afghanistan. So sit-ups can cause a lot of problems with the lower back. So you just got to make sure you're using the right exercises to strengthen the core. I've taken them out of all my programs. I don't use them with athletes. There's worse exercises out there, but it's just in my mind, I find it to be a poor exercise, and it's usually going to rob your spine of its vitality years down the road. I mean, I've done them. I know a lot of people have done them, and you might be fine, but it's down the road is where you're gonna, you might get up in your 45 and your back blew out on you. So just take that with a grain of salt. So right now I'm gonna go right into the actual portion of we're going to go over actual how to perform these exercises. So bear with me. I'm going to move my camera around and I'm going to put it on the floor. So okay. So first thing. All right. So if you this is something that gets neglected all the time for proper core training. So it's breathing and abdominal expansion. So first thing I want you guys to do before we get into any actual exercise component, I want to, you guys to first put your hand on your belly right here. Okay, on the front of your belly. So what I want you to do is take a big breath in, and as you breathe in, I want you to make a big Buddha belly. So expand, push the belly out, and just let it drop. expand again, and then just let it drop. And one more, we're going to expand and let it drop. Okay, next one we're going to do is we're going to grab around the sides, still underneath your rib cage, and I want you to just push the air out into your sides. Just a couple breaths like this. And one more. All right, and last thing, we're going to put our hand under our lower back, and I want you to just push the air out into your lower back. And this shouldn't hurt as you're doing this. Okay, everybody got that? All right, so now what I want you to do is I want you to take a big breath in, and I want you to think like you're pushing the air out in your front, sides, and lower back, almost like you got a big belt out, okay? So we're going to do 3-dimensional breathing. So we're going to expand our front, sides, and back, okay? You got that? All right, so now this will take us to the first exercise. So what I'm going to do is I'm going to place my hand under my lower back, just where the natural arch is, like this, okay? I got one leg down and one leg up. If you can see it, one leg is positioned down on the floor and the other one's propped up, okay? Just like so, whatever's comfortable. It might be one leg forward, whatever feels good with your back, okay? So from there, you're going to put hand under your lower back, okay? And I'm going to slide down so you can see me. And what I'm going to do is I'm going to expand 3-dimensionally, and I'm going to breathe out, almost like I'm spitting. And from there, I'm going to brace my core like I'm getting hit in the stomach. Then from there, I'm just going to lift my head a 1/4 inch off the floor, hold this for 5 seconds, and then lower back down. Not the most exciting thing in the world. Okay, so we try this again. So I'm going to expand like I got a belt. I'm pushing that belt out 3-dimensionally. I'm going to blow out, hold that air into my belly. Okay, brace like I'm taking a punch to the stomach. Lift the head a 1/4 inch off the floor. As you can see, I'm not turning my head all the way up like a sit-up. I'm just lifting it just like a 1/4 inch off the floor, holding that for 5 seconds, and then back down. Okay, we'll do 4 more like this. So expand, exhale, lift, hold 1, 2, 3, 4, 5. Back down, expand, breathe out, lift, hold, and then just 2 more. Hold for 5, and last one, and then hold for 5. All right, so that's the McGill curl up. Again, there's sexier exercises than that, but this does the job. Is really good, and again, it's a good starting point for most athletes. I still do this before I hit heavy squats and deadlifts to create stability in the core. Okay, it's not one of these exercises that's it's going to be with you for life. Next one we're going to do, this is going to be working lateral stability. So I don't know if everybody can see. I'm going to just try to position it the best I can. So what I'm going to do, I'm going to use the same bracing strategy. So I'm looking for lateral expansion, shrink wrap, pull the navel in, okay, brace. but I'm lying on my side from here. It's hard to see from here, but my legs are kind of bent from here, and I'm stacking them, and I'm trying to get tall as I can from my, I want to get as tall as I can from my head, sorry, from my knee to my head. Okay, as you can see from here, straighten out, and I'm posting on my shoulder from here.
You're not going up onto your feet, are you, Bret?
No, this is just a side bridge. Now, if I'm going to do a full side plank, which is nothing wrong with,
Gotcha.
you can actually do it all the way from the heels to the toe to the head. You can't really see that from here, but both are acceptable. For our purposes right now, for a starting point, I'll assume everybody's a beginner, and we'll do the side bridge, which is like more of a modified beginner position. All right, so just so everybody knows, my knees are kind of slightly bent right now, but I extend, get tall. I'm going to hold that position for 5 seconds. Okay, and remember, key is make sure you're bracing the core, and then back down. Okay, let's see if I can come back a little farther. And then again, and hold for 5, 4, 3, 2, 1. Good. Back down. We'll just do 5 per side. And again, 5, 4, 3, 2, 1. Good. Just 2 more. Again, 5, 4, 3, 2, 1. And last one. And 5, 4, 3, 2, 1. Okay, good. We're going to move around, position on the other side, and we're going to give this side a bit of love. All right, so again, same thing. Get nice and tall from your knee to your head. 4, 3, 2, 1. Back down. Again, 5, 4, 3, 2, 1. And 5, 4, 3, 2, 1. And then one more. Hold 5, 4, 3, 2, 1. Okay, good. Last one, bird dog. Let's see if I can do it from this angle. So I apologize for the glare here. I'm going to close this door. All right. So I'm on all fours right here. What I want to try to do is try to find a neutral spine position. So this is me extended. This is me in flexion. I want to try to find somewhere in the middle. Back is nice and straight. I'm going to use same core bracing strategy. Okay, and what I'm going to do is use my one leg and then my opposite arm. Okay, and I'm going to hold that position for 5 seconds. Okay, I'm going to extend out. 5, 4, 3, 2, 1. Okay, and we'll try that again. And 5, 4, 3, 2, 1. Good. Just 3 more. And 5, 4, 3, 2, 1. Good. And last 2. 5, 4, 2, 1. Good. One more. 5, 4, 3, 2, 1. And we'll switch. All right. I'm going to use my other leg, opposite arm. 5, 3, 2, 1. And 4, 3, 2, 1. And 5, 4, 2, 1. And last 2. 5, 4, 3, 2, 1. And final one. 5, 4, 2, 1. Okay. That was hard, hey? No, just all right. I'll take 15-minute break. No, just. Okay, so. All right, so. Everybody like that. Again, not the craziest exercise. I've done much crazier core exercises, and there's you're probably not going to feel a big burn from it, but what you're going to notice is over time, especially if it's done correctly, increase trunk stability, overall improved athleticism, and as mentioned, you should notice improved mobility throughout the rest of the body. Again, if that core gets stronger, everything else is going to help with a lot of different things. Next thing I'd like to talk about static.
Just a minute.
Yeah, sure.
For the bird dog, I've had a back injury, so like I fall right over when I do it. Would you just want me to like lift up my leg to improve like the core strength? Or...
Okay, so if were you doing one arm and the opposite leg, or were you doing both sides? You were doing left arm.
No, one arm and the opposite leg.
Okay, yeah.
But
So
I've never been able to since it happened.
yeah, so what it does is, okay, so the purpose of the bird dog is strengthen the multifidus. You guys don't really need to know the names, but anyway, it's an important spinal stabilizer. And if somebody's had a back injury, that could be vulnerable. So it's one of those things. It might be a referral out type of thing, but if you had to modify the exercise, I'd be literally looking at either just moving one leg, or just moving the arm, or sometimes just literally just moving the hand like an inch off the floor. Okay, I know that doesn't sound really that like you're doing much, but as soon as you lift your hand off the floor to do it, that muscle, the multifidus, is firing. So it's either modifying the exercise, the exercise, or stop it. Yeah, so it's one of those things you'd have to go from there in that regards. That makes sense?
Yep, thank you.
No problem.
Each one, right?
Another question there?
It was 5 seconds for each one, right?
What's that?
5 seconds for each stretch?
Yeah, you know what? 5 seconds is a nice baseline. It could be 3, it could be 5, it could be 10. It all depends upon your endurance. Again, it's just a baseline. What I wouldn't advocate though is to do like 20 reps of some of these exercises, because one thing about the core muscles in the core is they have poor fatigue resistance. So the meaning that they'll fatigue fairly easily. You see all these people doing these 5-minute planks, and some people actually have the strength to do it, but most people are just compromising their spine after 30 seconds. So it's one of those things. You have to get a 360. You have to know your body, and you have to be honest with yourself. If you're feeling that in the lower back and it's really aching, there's probably something that's going on wrong. So and then that being said, the bird dog is probably the most challenging, but it seems the easiest, because you don't have any feedback from the floor. You don't know. It's hard to judge where your body is. So again, one of those things to maybe get a friend of yours to like see how your back looks as far as alignment. If you're bending through your back, you're off kiltered. Again, it's one of those things you get a 360 on. I hope that I kind of answered that in a roundabout way. Next thing I'd like to talk about is static stretching and dynamic stretching. So, static stretching, if you were asking me what my warm-up was when I first started wrestling, it was probably a lot of static stretching. And knowing what I know now, there might be a time where it makes sense to do static stretching before an athletic event or sporting event, But for I myself personally, I try to avoid it, and I try to discourage athletes from doing it. There might be some muscles that might require it more than others. And what static stretching is like I got my arm out, I'm holding there for 20, 30 seconds, okay, just till it's end range. Then I switch over, hold the other one for 20, 30 seconds, maybe a minute, depending upon how long the stretch is. That generally should be reserved, if at all, after your sporting event, whether it's practice, okay. What you don't want to do is lengthen the muscle to its end range before sporting event, especially the hamstrings. The hamstrings are probably the worst to stretch for long holds before it can leave the knee very susceptible to an injury because it loses its stability. So an alternative to that would be dynamic stretching. So dynamic stretching is more you're just holding for a brief second, and then you create movement, and all it's doing is just getting circulation to the body, and then we're not shortening the muscle to its end range. Okay. That all makes sense. I'll just kind of show you an example. So say if I did want to stretch the hamstring, it would just be like here, hold, and then walk, here, hold, walk, and keep on moving, okay? Versus bending down, touching my toes, or doing a hurdler stretch or any type of stretch like that for an extended period of time, okay? This is very, very important piece of information. Something I like to go over, they're called D1 and D2 patterns, PNF patterns. I really like using these, and you'll see some athletes use these before sporting events. They do this so quick that you can hardly even tell what type of, that they're doing these patterns. But if you watch the Olympics, you'll see some athletes doing it. Probably some of them are going to be doing it in a more ballistic, fast, explosive way. But what the benefit of this is you're able to move the shoulder joint and the hip joint and triplane motion. So just like how most sporting events are, you're not just like straight forward in this plane, you're moving in multiple planes, okay? So we're gonna take the camera out again. Everybody set up their camera, and we're gonna do one more specific component there. This is the practical component, and we're gonna go over D1 and D2 patterns. I wish somebody named them something different than that, but I didn't name them. All right, so first one. Let's see. Oh, okay. I'm gonna move back a bit. All right, so first one is instead of worrying whether it's D1 or D2, I'm just gonna call this the seatbelt. So what I'm gonna do is I'm gonna reach across my body like I'm putting the seatbelt on, like this. Okay. Stretch as far as you can. And what I'm gonna do, okay, so I'm adducting, I'm bringing my the arm close to me, my hands internally rotated. What I'm gonna do is I'm gonna externally rotate like this, and I'm bringing it back here in extension, okay? Like this. So again, you don't have to know all the terms, but I'm gonna go a little farther back just so it's up like this, and I wanted you to see what I'm doing with my hand. You see it's going back like this. Okay, can you guys see that? Okay, so I'm in here like this, and I'm gonna rotate the palm down like this and back like that. Okay. And again, if you were like, you might be going like this. You want to do it fast, both sides like this. Okay. Got it? And you can grab a cable too. If you want to just strengthen this pattern, grab the cable, pull it down like that. Okay. Again, this works well into dynamic patterns. Okay, just like this. Somebody, you might feel your shoulder click as you're doing this. Everybody got that one? All right, next one I'm going to do is I'm going to pretend like I'm grabbing, I wish, so if you can see down my hand right here, it's almost like I'm pulling a sword right out of here, like this. So you got to rip up my hip like this. Okay, so I got the sword, and then I'm unsheathing it, and then opening up my palm like this.
Are you reaching cross body, Bret?
Yeah, I'm going cross body. So I'm pulling the sword in from here and open up from here. Okay. Okay. And then we're going to do the other side. Okay, everybody got that? And again, this wouldn't be all I would add to dynamic mobility. This is just like one portion, but I find it could be very beneficial instead of me going through a whole series of dynamic movements. Next one we're going to do is soccer kick. So I'm going to bring my legs down here so you can kind of see it. So, no, I'm going to have to get my foot down here. So, see, I'm doing like a soccer kick, like this. Okay, what I'm going to do is I'm going to internally rotate my foot and bring it back like this, almost like I'm doing a pirouette in ballet. Yeah, and then I'm going to kick in again, toes externally rotated. I'm going to internally rotate it and abduct it away from my body. Kick here, and again, internally rotate. This is money for the hips. Make the hips feel, and again, a lot of knee injuries stem from issues with the hips. Okay, got that? You do the other side there if you want to check in on the other side. Okay, soccer kick. Turn that in on the way back. Soccer kick, and then back. Okay. Last one we're gonna do. It's called the snow plow. Okay, or it looks like a snow plow, I should say. I think it's D2. So gotta make sure I can see. So I'm this leg is away from my body like this. It's turned internally rotated like I'm doing a snow plow. What I'm gonna do is bring it into my body and externally rotate the foot. Okay, and then kick it out again like this. Okay, and again, bring it back and there. Just like so. Okay, snow plow, back in towards the body, like so. Okay, and then we're going to try the other side. Okay. All right. So guys, don't worry if you forgot half that. First time I learned these, I had to go over them again just to review them. So if you have to go online and you can find as with the McGill Big 3 too, you can find just a search for McGill Big 3 in case you forget it how to do it. And then with the D1, D2 patterns, check out D1, D2 patterns for lower body and the D1, D2 patterns for upper body. And again, it's great to build into your dynamic work and into your program. So let's go over. We're wrapping up. here. The last portion is going to be pretty quick there. There's a lot on there, but we're going to go pretty quick. So importance of a balanced strength and conditioning program. So what this means is focusing on balancing the muscles that you see in the mirror with those that you can't see in the mirror. So the muscles you see in the mirror are your anterior chain. The ones that you don't see in the mirror are posterior chain. So if your focus is just on what you can see in the mirror, then you're going to have some problems, and you may be putting the body out of balance. And trust me, I know a lot of guys in the gym that years of just focusing on what they see in the mirror, thighs and chest, and maybe some abs. And down the road, it's just going to pull you in like this, and you're going to be walking with a hunchback, and you're not going to be playing many sports into your later years. So just some key advice. So here's a sample workout, and you guys can follow along. I put it on the sheet. So this is performed 2 to 4 times per week. You would do like a warm-up, 5 minutes of cardio. For wrestling, skipping is a good one because, again, it works on footwork. You can throw in some of those D1, D2 patterns there, and some type of other dynamic specific mobility that's more specific for you. You could do from there, go to a core specific routine like the McGill Big 3 that we just did. Then we get into the strength portion. So again, allocate about half hour to 45 minutes, and could even be done quicker. Sometimes mine are like 15 to 20. 3 to 4 sets of reps of 6 to 12. Again, this is just general. You're going to pick 1 to 2 exercises per body part. So for the lower body pull, it would be your hamstring dominant exercises. So they'd be like deadlifts, a hamstring curl, or hip thrust. Upper body pull would be dumbbell barbell row, an inverted row, or pull-ups. Lower body push would be squats, lunges, step-ups. Okay, so they'd be more your quad dominant. And then your upper body push would be like push-ups, dumbbell, barbell, bench press, landmine presses, all that type of stuff. And again, this is just general rep range, 3 to 4 sets of 6 to 12 reps. Again, if your goal is more on the strength side of things, you'd be going closer to the 6th rep or lower. If you're more on the endurance side of things, you want to improve your endurance, 12 or 15 reps or more. Again, it depends upon where you're at as far as your conditioning and everything like that, and strength. I often like to finish off with conditioning. So you're, what that means is like, it's just like a short cardiovascular routine you can do at the end of your workout. Sled pushes are great. Tabata hit circuits, which are just like 4 minutes of hell. And some type of cardio intervals. Okay, you can incorporate that at the end. Again, and you combine the two, you get a fairly efficient workout for your sport. Cool downs, you usually allocate 5 to 10 minutes of light cardio at moderate intensity, so anywhere from like 50 to 60%. We're just trying to get our heart rate down, and or some breathing exercises. Again, like that breathing exercise we did at the beginning, I often will plug those in with clients at the end of workout. So a couple caveats: body weight or light weights should be introduced in the higher rep ranges at the beginning. So 12 to 15 reps. If the athlete is beginner, just to build up that muscular endurance, and then you can go from there. Olympic lifts, plyometrics, box jumps, etc. Great for improving speed and power. But I think they really should be introduced after an athlete has shown that they can master the basics. Again, you get some athletes that are more athletic that can jump into that right away. It all depends upon the individual. But again, I don't like introducing that too early into a program. All right, so let's last portion. We're just going to discuss about injuries in general. So sprain versus strain. For the longest time, I didn't know the difference. I always would mix them up. But a sprain is a stretch or a tear in a ligament. The ligament connects bones together. A strain is a stretch or tear in muscle or a ligament. And they attach the muscle to the bone. Okay, it makes sense. So common symptoms of sprains and strains are pretty well identical with one exception. So for sprains, there's going to be bruising, pain around the affected joint, swelling, limited flexibility, and difficulty using the joint's full range of motion. So with the sprain, the big thing is the bruising. Okay, so if you see bruising, chances are that's a sprain. Okay, so the sprain has to do with the ligament. If common symptoms of strains would be muscle spasms, and that's probably the big hint because it's dealing with the muscle itself. Pain around the affected joint, swelling, limited flexibility, and difficulty using that joint's full range of motion. Okay, practically the same. The only difference is there's a muscle spasm. Okay, and again, some of these things can vary with individual. One thing we want, again, if you have a broken bone, you're probably going to know, but sometimes there's certain areas that are going to be harder to detect. But when you've got a broken femur, you're going to know for sure. So signs and symptoms of broken bone include swelling or bruising over a bone, deformity over the arm or the leg or whatever joint we're dealing with, pain in the injured area that gets worse when the area is moved or pressure is applied, an ability to bear weight on the affected foot, ankle, or leg, and loss of function in that injured area. So it's really important to know the difference between general soreness and an injury, which would be like a strain or a sprain or a broken bone. Because I've had this for a lot of athletes, especially youth athletes that come to me, and it might be just like they got a little bruise on their arm and they think they're injured. So again, it's just important to know the difference between those, and again, when in doubt, refer out. So go see a therapist or see your doctor, and your doctor will refer you to a therapist, hopefully. So some of the risk factors for injury would be being tired because of lack of sleep, improper technique, being out of shape, not warming up or cooling down, and improper hydration and nutrition. So those are some of the factors. Again, they're not all the factors, but there are definitely some things to be aware of. So warning signs of a potential injury would be like lack of centration in the joint. So if the joint just feels like shaky, like doesn't feel centered at all, this could be a potential injury. If there's pain that is persistent and it just keeps on getting worse during an activity, that might be a potential injury. Lack of strength in the particular limb could be another potential injury. And like I said, it's important to see a doctor and or a therapist to incorporate prehab instead of rehab. So we want to make sure we're resolving the issue before it becomes a full-blown injury. And you want to make sure that you adhere to the advice of your doctor and therapist. This may mean taking a break from your sport or modifying your training. Might mean if you have a knee problem, maybe you'll be able to pummel or work the upper body, but you won't be able to work the legs. Again, it's just something it's a conversation you'll have to have with your doctor, therapist, and you want to involve your wrestling coach in there too as well, so he knows what's going on. All right, so last portion there. All right, so I'm sure everybody's heard of the RICE approach, rest, ice, compression, elevation. Okay, so That means if you have an injury, you may want to rest it. You may want to apply ice. You may want to compress it and elevate it. Now, there's a little bit of a debate on that, whether to use this approach or the tech approach, which is traction, elevation, compression, and heat. So some theories out there that putting on ice will alleviate the swelling, but again, your body needs to go through that swelling process. So, and sometimes excessive rest might cause more problems than help. So again, it's one of those things. It's a case. It depends upon the individual, the injury, and it's really a rabbit hole conversation. We could probably talk about this for an hour and never really get anywhere. Anyway, so the therapist is probably going to advise you one of the approaches there. So I'm going to open up to questions from here. Before I do so, let you know that I left some information below, my personal phone number and email if anybody has any questions that don't get resolved here. And also, I have 2 clinics that I work out of right now. One's Strides in Elmsdale, and one's Kinesis in Bedford. So if any of you guys experience, oh, there we go. There's my beautiful picture. Perfect timing. So if any of you guys experience any injuries or something that's just been nagging for a while and you want to see a therapist, I'll be the man for the job. All right, so I'd like to open the floor to any questions, comments, if anybody has any. If not, go from there. Yeah, I guess we can unmute from now.
I got a question.
Yeah.
Lucan, go ahead.
Okay, who's speaking? Sorry.
Lucan, you go ahead.
Okay.
So you said there was exercise to avoid. Which was that could injure the back or do more harm?
Oh, sit-ups. Again, it's one of those things. You might if your coach is getting you to do sit-ups, you know what? Play nice, but it's one of those things. Down the road, it can rob your spine of its vitality, and it's just like bending a branch over and over again. If you're bending it over and over again, you're gonna wear at some of those joints. Probably okay for like a practice here and there, but I would try to avoid it. Especially, I would avoid it outside of practice if possible. Yeah.
Would you recommend to do the McGill?
Honestly, I'd recommend it. Yes, as long as you're not experiencing pain doing the exercises as well. Again, the McGill Big Three is a good program, but it's like I said, there's certain individuals that might, if you experience tweaking your back, or you're out of position, or you're not doing it correctly, you may experience some pain doing it. It's possible. I mean, I've always found it a fairly safe routine, but it's a good starting point. Another thing I didn't mention too, if I had to add anything else, 2 other exercises, I would also add farmer's walks, which is just like carrying weights by your side. It's really good for wrestlers too because it incorporates grip strength, and there's a lot of athletic carryover between carrying heavy weights by your side. You wouldn't think so, but it actually works really well with athletes. And bear crawls or crawling patterns. Crawling patterns are really you really see them in MMA and wrestling. And they're really good. If performed correctly, a really good core exercise as well. Yeah.
Quick question.
Yeah.
Would V-sits do the same damage as sit-ups, like over and over?
What was that? Knee ups?
Would V-sits do the same as sit-ups?
Yeah, I'm not a big fan of V-sits either. anything that bends that causes flexion of the spine, like too much flexion of the spine, can it's going to be it's for generally for most people they're not going to feel it right away. Could take years, and again it depends upon the individual and their anatomy, but it wouldn't be the first choice that I would pick either. Yeah.
Oh, okay. Thank
Again, your the spine's not gonna explode like from doing a couple sit-ups and V-sits, but it's just one of those things just to keep in mind, especially as you start to age, and you want to avoid putting that into your program over time. Yeah. Again, we're all gonna do we got to do neck bridging in our sport. It's not the healthiest thing. There's a risk and reward for it, but again, with the neck bridging, you need those strong neck muscles in your sport. So again, it's a bit of risk reward type of thing. Yeah.
I have a question.
Sure.
You said that you recommend side planks, but did you say don't do like the regular planks because it like strains
Oh
your back?
no. I didn't put those in just because I didn't know where everybody's fitness level was at. No, I think if you feel like you've mastered the side bridge off the knees, then by all means go to full side plank. Yeah.
No, I got that, Pet. But like, what about like just like your two hands on the ground and you're straight, like
Oh, you're
parallel?
talking about a front plank. Yeah.
Yeah.
Yeah. There's nothing wrong with a regular front plank. The whole thing is, if your back is bent like this in the middle, then it could be a bad exercise. So you got to make sure you're keeping a neutral spine. What that means is like from head to my tailbone should be fairly flat. Okay. If I'm caving in the middle, then I'm compromising my lower back. So it's just all of a sudden a good exercise became a bad exercise. Does that make sense?
Yep. Thank
Yeah.
you.
So no problem.
So make sure you always flex your core, like all of it, even your back and everything.
Yeah, it's exhausting. Yeah, and the carryover in that in sports is like just before you're about to if I'm about to do a leg takedown, I gotta instantaneously just for a quick moment create that interstability. So it's not just while doing the exercises when I'm doing my techniques. I got to create that stable spine in order to be able to perform my techniques. So it carries over beyond just doing the exercises. And also too, when you're lifting weights, whether you're doing a squat, you got to create that inter-abdominal stability. If that inter-abdominal stability is not there, again, your body's you're going to rob it from other places of your body. Make sense?
Yeah, thank you.
No problem.
Anybody else? Once, twice. If you guys do have any follow-up questions, Brett's contact info is there, and we're going to post that up on our Facebook page and our Instagram. We've had Bret come in before. Some of you are old enough to have been around for the camp, the Robinson camp that we ran in Halifax, and Bret came in and did some like basic movement patterns and stuff like that. So I really enjoyed this. I feel like I got some movements out of there. I know that's myself as I've aged. I very much was part of that old school of the wrestlers. We were doing the sit-ups and stuff after practices and you know, the just wear and tear on our bodies. And you don't realize until you start getting older how much it just sort of robs you in that way. So that was one of the reasons why I wanted Bret to come in and just talk about injury prevention. Prehab's a big one. If put the time in now, because it's going to pay off and like spades down the road. I can't stress that enough. And those of you that are in Halifax or near the HRM, like if your parents have insurance, invest in it, because it's going to save them a fortune in rehab. I've don't know how much. There was one summer alone I know we spent as a cost of the program almost $3,200 in physio, and it still did not fix one of my shoulders. But if I would have maybe just spent some time doing some prehab, doing these range of motions and stuff like that, probably would have still had the full use of my left side, right? And again, I've told you guys this, probably would have extended my athletic career. So it pays to take care of your body ahead of time. Bret, thanks a lot. That was fantastic. Like I said, I got a lot out of it, and the fact that we had so many questions at the end at 9:38 at night from a group of that speaks a lot. So again, thanks so much for coming and joining us and sort of passing along your knowledge.
All right. Well, thanks everybody. You guys were good to work with. Good crew. And again, like I said, hopefully maybe I'll see one of you guys in my clinic in the next few months or so. And again, feel free to drop me a line if you have any more follow-up questions.
Perfect.
All right,
guys. Thanks, Bret.
Thank you for all the info.
Thank you, Bret.
Thank you.
Thank you, Bret.